Welcome back, y'all. Joining us now in studio is Ginger with Caring Hands of Texas. Thank you so much for coming in today.
Thank you for having me.
Yeah, so tell us a little bit about Caring Hands and what you do there.
We are Caring Hands PPEC of Texas. PPEC stands for Prescribed Pediatric Extended Care, and these centers were brought to the state of Louisiana in 2017, and currently there are 5 centers across the state, and we are licensed by the Texas Health and Human Services. So basically, if you think of a daycare type setting but with skilled nurses. So we want to have a fun, wonderful, loving environment for them while they're learning and growing, but also getting the skilled nursing care that they need. We also have physical therapy, occupational therapy, and speech therapy there in the center, and our focus is to prevent further complications and hospitalizations with them, kind of be the go-between with their physicians and all the specialists that they have to make sure they're getting everything that they need.
Now, what type of conditions are the patients you treat living with?
So anyone that currently has private duty nursing is also going to qualify for our center, and actually the program was designed for us to work hand in hand with the private duty nursing, where they have their private duty nursing hours in the afternoon or evening time and on the weekends, and then in the morning we're open from 7 a.m. to 6 p.m. They can come to our center, and I get that most important thing that we provide, which is socialization, and that's being with other children that have the same type and similar complications and diagnosis that they do, and still get the nursing care. And we take ages of 0 all the way up to 20 years of age. And a typical type of patient may be one that has cerebral palsy, maybe they have seizure disorders, they may have hydrocephalus and have a shunt, G-tube feedings, they could have cardiac conditions, respiratory conditions, needing oxygen either all day or some of the day, trach patients, IV therapy patients, wound care, all the way up to a ventilator patient.
Wow, you must have a very talented nursing team.
We do.
There.
They're very skilled at what they do.
Who pays for these services?
So we are funded by Medicaid, and that's the MCOs like United, Texas Children's, and Superior. And that can be their primary or their secondary. If they have Blue Cross as their primary, we will bill their secondary Medicaid. And it basically takes about 2 to 3 weeks. We get all their information together, gathered from every specialist and the parent, and then we send that off to the insurance company and get a prior authorization. But we can also get an urgent review if the physician or the hospital says we really need this patient to start coming to you as soon as possible. We can get that within 24 to 48 hours.
Wow, if anyone's interested in taking advantage of the services y'all offer, who can refer a patient?
Anyone can refer a patient. That obviously their primary care physician, but it can also be a specialist that they see, like their cardiologist or respiratory physician, neurologist, and anyone in the community as well. If they have ECI, which is the early intervention, we can work with them, and we also refer to them. So if they have a patient that they feel may qualify for us, and us likewise, we can do both services together. They don't have to pick which one they want to do. They can still get their early intervention and still come see us and get all the therapies that they need as well. And of course, anyone, parent can call us and say, I think I have a child that may qualify. We will gather a bunch of information from them, contact all their specialists and their doctor for them, and put together an individualized plan of care for them, which is our orders of what we are going to do for them as a skilled nurse.
Ginger, thank you so much for coming in and for what you guys do over there at Caring Hands.
Thank you so much.